Hello, this is Dr. Bouvier with Doctor and You. I'm here with a good friend, Dr. Bob Winford, and we're talking about the 4 ingredients to a successful healthcare process. Now, you have to understand there's insurance care and then there's quality healthcare, and many times there's a discrepancy there. So let me explain what that means. To have a good example of what happens in good healthcare for the whole population
Sure.
is 4 basic things. You have to have a good caregiver. If that caregiver is yourself, then that's fine. You have to have good transportation. You have to have a good physician and provider backup, and then you have to pay for things that insurance doesn't pay for. And I'll give you examples of that whole process. So number one, you have to have a good caregiver. We have a lot of patients who are locked in their home. They're immobile. They can't move, and 100 years ago, the doctor came to them. That
Sure.
doesn't happen, but maybe 5 or 10% of the time now.
Mm-hmm.
And the home health care agencies, those gals are absolutely great and wonderful, but it's limited.
Sure.
When a paramedic comes in or an ambulance guy comes into the home, they don't even get paid unless they transfer back to the hospital.
Sure.
So there has to be a good caregiver of some sort there. If you're your own caregiver and you can't go wash your body and cook your food and clean your house, then you have to have somebody else do that. If you don't have somebody else to do that, then your quality of care caves in. You end up
Sure.
back in the hospital over and over and over again.
Mm-hmm.
Does that make sense?
It does.
The most expensive thing in healthcare is the hospital. Hospital takes up, of the $3 trillion we spend every year in this country, the hospital absorbs 40 to 45% of that.
Mm-hmm.
So if you're gonna save money, then it's how do you utilize these wonderful hospitals that we have? And what I mean by that is, from this caregiver standpoint, many people, because they don't have a good caregiver, will end up in the hospital. And you can talk to any emergency room doctor or nurse out there, and they'll tell you 90% of the things that come into their emergency room do not need to be there.
Mm-hmm.
90%.
Wow.
So, and the ambulance people will tell you also, well, I transport, even though we can take care of them there, I transport because that's how we get paid.
Yes.
So one of the fixes of healthcare would make sure you have a good caregiver, but part of that would be pay the paramedic when he goes to the hospital or to the house. If it's truly not an emergency, we've got telemedicine, all these other cool things that we can reach out to doctors and quality people. It's happening in some areas of the country, but not right now.
Mm-hmm.
So that's the first one. That's the caregiver issue, and there's more about it, and it's not that simple, but that's all part of it. The second thing is you have to have good transportation. Half the time, people, when they're sick, they don't go to the doctor. I'll wait because I don't want to bother my son or daughter, or I can't get there. And they wait until it's too late, and then it's an emergency. They got to be transported.
Sure.
And they end up in the hospital 3 or 4 weeks longer than what they really could have done. And if they had a $50, and we can do this all day, we can pay somebody $50, a couple of ambulance companies, and they'll take them to the office and bring them back.
Okay.
But you wait 3 or 4 days, and they spend $800
Mm-hmm.
to transport them by emergency medical service.
Mm-hmm.
You see what I mean?
Yeah.
So transportation becomes a very, very important role here. And it's getting better, but transportation is still a major problem.
Mm-hmm.
But that's the second component to good quality care if somebody wants to take care of public health, population health, things like that. The third thing is you have to have good physician and provider backup. And the reason I make a distinction between physician and provider is because a provider is a lab, an x-ray, a hospital is a provider, the durable medical equipment, the people that put braces on, those are all providers. A nurse practitioner, a community paramedic, an MA, these are all providers as well. But so are these other facilities. They're all providers. Then there's the physicians. They're the actual doctors of medicine who diagnose and prognose and create these care plans, right?
Mm-hmm.
By the way, nurses are so much better at care plans than doctors are. Just
Okay.
a little side note there.
Sure.
Little rabbit trail.
Okay.
Can't have the video without a little rabbit trail,
That's
right?
exactly right.
So having good physician provider backup, that's the third thing. The first thing was good caregiver, second transportation, third was physician provider backup. The fourth thing is critical. And somebody's got to pay for things insurance is not going to pay for. If I spend literally 80% of my day talking with insurance companies and negotiating good health care. There's insurance care, and then there's good health care, right?
Mm-hmm.
And there's a lot of people out there, probably 70% of the general population, that says, if my insurance doesn't pay for it, I don't want it.
Mm-hmm.
Well, then they don't use the acupuncturist, the chiropractor, the homeopath, the naturopath, and all these other alternative integrative care things that are available in our community. They're not paid for. The vitamin C, the exercise to pay for the health club, things like that. Those are all good quality healthcare things, but it's not paid for by insurance company, and they shouldn't. Let's face it, insurance is for the what ifs that happen in life.
Mm-hmm.
It's kind of like car insurance. You're not going to have somebody change the color of your car, change the oil. That's not what insurance is for. Insurance is for the what ifs that happen. People need to pay for the other stuff, and they do, and people do, right? So, number one, you have to have a good caregiver. Number two, you have to get good transportation. Three, good physician provider backup, and then number three, you have to pay for things that insurance companies that traditionally don't pay for. And those are the four components of good quality care that we work for.
Sure.
Did that answer your question?
It sure does. It sure does. Yes.
Well, thank you very much
Yes.
for all the things that you do, Dr.
Yes.
Bob Winford.
Well, thank you.
Again, this is Dr. Robert Bouvier talking about the four essential items that are components of good healthcare. Thank you.